help the patients as well. So ladies and gentlemen, if you just gather around a bit, and we're going to introduce them. And this is Andy Coogan, and good afternoon.
Good afternoon.
Go on.
My story started approximately 4 years ago in 2010, when my wife and sister that I go and have a checkup with my local doctor, and she did a small blood test and found that I had quite a high PSA, which is an indicator of prostate cancer. I then got sent up to Northwick Park and seen various surgeons and consultants, and got put under a brilliant consultant called Nicola Inarmane, who's a fantastic surgeon, and she sorted out, and I had about 31 days of radiotherapy, and that was followed by brachytherapy, where they actually put several little tubes into the prostate and then put a radioactive pellet into it. So to make sure that if the ordinary radioactive treatment hasn't got it, then the brachytherapy will.
So obviously, was that a difficult time? Obviously, adjusting to the treatment and everything else, or
not at all. Not at all. No. The most difficult part of it was the first couple of times when I went to have the radiotherapy. You have to drink a litre of water a day, well, just 20 minutes before you actually have it. And the problem was I didn't realise that if you don't warm the water up first of all, it really is difficult. So wait for 20 minutes, then go 20 minutes under the machine, and then a quick dash to the toilet. So I learned very quickly and had some warm water. But the radiotherapy there's no pain at all under it, and basically the brachytherapy wasn't any pain. I was in for 2 days, and it was a little bit of discomfort for the one day.
But once you got over that, you ended up developing diverticulosis, I believe, isn't it?
Yeah, so 6 months later, not necessarily related to what I had, but I developed a problem with my colon, and I was referred again back to my GP, and he sent me to see Professor Sue Clark up at St Mark's, and I actually seen the registrar first of all, and he put me on a course of antibiotics and said come back in a couple of weeks, which I did, and I think Professor noticed that my weight had continued to drop. I think I went down to about 7.5 stone, and I think this was because I wasn't eating very much, but they took me in straight away and gave me what they call a Hartmann section, which is a corner bit of the bowel come out, and I think I was only in there for 6 or 7 days, and it was, I had to take things easy for a couple of months after that, but after 3 months, it's fine. We dragged a caravan on holiday, and there was a lot of lifting and putting things up and what have you, and I've never looked back, I'd probably recommend anybody who's got any kind of problem with their waterworks or anything like that, go and ask your doctor to get your PSA checked. It's not a great big deal.
Well, thank you.
Hello, my two friends. Thank you for coming from St Mark's whole bowel awareness day. I'm one of the paediatricians at St Mark's, and I'm responsible for looking after anyone who from 0 to about 16 or 18. So from about 2 kilograms to about 200 kilograms.
That's me, 200 kilograms. Oh, seriously. So obviously, tell the difference in the symptoms different, or is different things about it when you're looking for some things, identifying things in a young person?
So I will take people from cradle to the end of adolescence, and so I'm responsible for looking after diseases that start in childhood, like food allergy. Children have bad gut problems related to foods that they eat, food intolerance, right the way up to the onset of diseases that St Mark's specialises in, like Crohn's disease and colitis, and then ultimately I also look at children who are at risk of getting bowel cancer when they're in their adulthood. So right the way through all the range of those conditions.
So is that young kids that could be predisposed to getting bowel cancer? Is that
So
because it's in the
there are
family as well?
families where there's a strong family history of bowel cancer, and if we meet the children early, we can undertake preventative strategies to stop them getting cancer in their young adulthood.
With young people, what can the parents look out for, like for symptoms of lots of, whether it's Crohn's or whether it's...
So we're interested in seeing anybody who has unexplained gut symptoms, basically. If you've got bad guts, you've got bad diarrhea, if you've got bad skin related to what you eat, we'll look at you and we'll probably be able to change your diet or try and achieve a diagnosis for you.
So is it more preventative than...
So there's two limbs to the work that we do. We do a lot of preventative work, so we look at children who are at risk, perhaps from food allergy, or at risk of conditions like Crohn's and colitis because their family have got it. And we'll also look at families where they've had early colon cancer, and we'll look at preventive strategies for them. And then there's also those who come with treatment, who need treatment, who have got active bowel disease, and we'll see those and start their treatment so they recover. And it's good outcomes. Children and adolescents do much better than old people. I don't look after old people.
I suppose it must be quite nice on a personal level, because you literally might see a 2-year-old and then you're going to grow up with them for the whole bit from teenage years.
I start with people who are age 2, I look after them to about 16, and then they tend to bring me their children. I'm now that old. I'm going around the circuit twice.
Why paediatrics yourself though, personally?
Why do I like paediatrics? Because children are a lot more fun than adults. They get better very quickly. So the stakes are a bit higher, but if you start treating people quickly and well, they recover very quickly. And there's always someone to look after them when they go home. So why would you look after adults?
Yeah, I can see where you're coming from here. It's just children all the way, isn't it?
It's children all the way. So if you've got any gut problems relating to children, then this hospital is the place to be.
Are you going to be around for a little bit longer?
I've been hanging around, so I'm happy to be here.
Okay, if there's anyone here who's got any young children as well, come along and see Warren as well. Have a chat with him as well. And obviously with the young child, there's face painting down there. It's only going to cost you £3. Warren doesn't have to do it, but he's more than happy, I'm sure, if he wants to. But it was, you raise a bit of money as well, and obviously at a more serious note you can chat to Warren if you've got any issues or anything you want to talk about. Thank you. And Davina's got 2 friends. One's called Aaron. Has this one got a name?
Not at the moment.
No, okay, so if you want to come up with a name for our friend here, right?
Maybe we can have a competition.
Yeah, a little competition for his name. But what Davina's going to talk about is, there's lots of different things. It's going to be about diet, it's going to be about the screening programs that are going on as well. And she's going to demonstrate sort of things on there. And then we're going to unravel something in a minute as well. So let's just start. So first of all, you were saying about the screening things earlier, yes? So it was like...
Yeah, so I work for St Mark's, and my role is to raise awareness of the NHS screening programme. There are 2 elements of the screening programme. One is for age 60 plus, and there's also another one for age 55.
Is that for male and female, or is that different?
Now, with the screening programme, both male and female are eligible, and as long as they're registered with the GP, they're eligible to take part.
Okay.
And in terms of the 60 screening programme, if a patient is registered with the GP, they'll automatically be sent one of these test kits in the post. It's something that they need to do at home, and it's basically providing a stool sample and sending it back to St Mark's for testing.
And it's as simple as that? Yeah? Oh, there's a bit more.
Yes, it's as simple as that. If I can have my assistant, please, if you'd like to come round. I'm running out of hands. As I said, this is a test kit that's sent to patients in the post, and they're also sent instructions and cards with sticks and an envelope as well. But basically, what you need to do is collect a stool sample. So here I've got my Play-Doh, my plasticine. So if you can just imagine that this is the poo. So you need to collect the sample before it goes down the toilet. Some people use toilet paper to collect it, some people may use those disposable gloves you can throw away, but because you're doing it at home, it's whatever you feel comfortable in doing. So you write the dates on the test kit, you'll take the stick, you take a little bit of the sample, you'll lift up the flap, and then you just wipe it on the first window. You throw that stick away, and then you take a second stick, and from a different area of the same sample, you will wipe it on the second window. And that's all you need to do. And then you send it to St. Mark's for checking for blood.
Okay, and if there's any issue with that, they'll come back to your GP or track yourself?
And St. Mark's will come back to you. So if they need to do further investigations, they'll ask you to come in. They'll ask you about your diet, any other health issues that you may have, and they may also offer you a colonoscopy as well.
And is this just to link with cancer or other bowel diseases as well?
What they're looking for is polyps.
Right.
And they do know that polyps sometimes bleed. So if they're bleeding when you do the test, they may show up on here as well.
And something like polyps can be dealt with reasonably easy, can't it?
That's right. The key thing to enter the screening program is that if it's caught early enough, the success rate is very high.
Okay.
Right, but before I talk about the other element of the screening program, I just want to show you this. This is the model of the human body. This is what we all look like inside. And here we've got the liver. Here we have the stomach. We've got the small intestines here. And here we've got the large intestine.
Okay. Now, shall I do this thing now that we're going to do? Right, so this is quite interesting. We did this earlier. So let's see if we can do this, right? So what I'm going to do, actually, I'll tell you what, Aaron, if you go at the front and hold that, right, and I'm going to get someone, I'm going to find a volunteer in a minute. So let's come around. Here's Bob. Right, so Bob's got that end. So what we're going to do, now, if you think Aaron here, that's kind of the top of your chest. Sadly, Bob has got the dubious end. But if your bowel was undone, this is what's in all of us now, that is the length of what's inside you, of your bowel. 30 foot, I think, Bob, isn't it? 30 foot? Which is quite amazing. That's all wrapped up inside you at the moment. So obviously you can see, with all the doctors, you obviously can see the security van as well. So let's get that out of the way. Thank you, sir. So obviously you can see that all the doctors have, it's a real dilemma when they're trying to find the certain points in here as well, and trying to diagnose things as well. And the best way you can all go about that is obviously the early detection and all the things that we can do to help that out. So thank you, gentlemen, if you'd like to roll up your bowel.
Thank you very much. The other element of the screening program is targeted to age 55. So once again, it's to both men and women. If you're registered with the GP, you'll be invited to take part. It's something that you need to do at home, but it's basically administering an enema, and then you'll go to St. Mark's where they look at the lower bowel for check-in. But can I just stress that it's very important to be bowel aware. So if anyone does have any symptoms, if they have constant diarrhea for several weeks, maybe bloods, it could be in the toilet bowl or on paper, if you have an unexplained lump or stomach, or pain in your stomach, then it's advisable to pop along to your GP and get it checked out. It doesn't mean that it's bowel cancer, but it's always good to be self-aware.
Okay, anything else you want to add, or is there anything else you want to mention? No, the diet, that's the one thing we were going to talk about, diet and how we can...
Right. Thank you for reminding me.
That's all right.
With the diet, it's always good to have a balanced diet, so make sure that you have your fruit and vegetable. I think most people are aware about the 5 a day, but they're now talking about having 7 or 10 a day. And I think that some people find that quite unachievable, but the key thing is to have a balanced diet, make sure you drink lots of water, have some fibre in your diet, and if you can increase your fruit and vegetable, then please do so.
Which is quite interesting, because I think they did a survey after this, saying about 7 a day and 10 a day, that only 30% of the people in the country at the moment are actually managed to get to 5 a day.
That's right.
So there's still a distance to go on that.
That's
really.
Right.
So obviously, again, it's about your diet. A lot of this stuff can be prevented by diet, really, isn't it? And changing things and simple things in your diet as well, isn't it? And
it's also, if you smoke, then not to smoke. If you drink, to drink in moderation, to keep fit, exercise, gentle walking.
Okay, all right, brilliant. Thank you very much indeed. Ladies and gentlemen,
Thank you.